A phlebotomist inserts a needle and sees no blood flow. Slight adjustment causes a sudden rush of blood. What is the most likely explanation? A. The needle bevel was against the vein wall. B. The tube was defective. C. The needle gauge was too large. D. The patient's blood pressure was too low. Answer A. If the bevel is pressed against the vein wall, flow is obstructed until repositioned, causing delayed blood return once adjusted. While performing a venipuncture, the patient suddenly faints. What should the phlebotomist do first? A. Remove the tourniquet and needle immediately. B. Call for help before removing the needle. C. Hold pressure without removing the needle. D. Lay the patient flat before removing the needle. Answer A. The first priority is to prevent injury or bleeding. Both tourniquet and needle must be removed immediately before assisting the patient. If a lavender top tube is overfilled, what will happen to the sample? A. The plasma will become hemolyzed. B. The red cells will shrink due to excess EDTA. C. The blood will clot partially. D. The plasma will show falsely elevated calcium. Answer C. Underfilling affects anticoagulant balance. Overfilling causes incomplete mixing, leading to partial clotting. When using a butterfly for coagulation testing, why must a discard tube be used? A. To remove air in the tubing that affects the blood ratio. B. To prevent underfilling by flushing the vein. C. To allow blood flow to stabilize before testing. D. To activate the anticoagulant in the tubing. Answer A. Air in butterfly tubing reduces the correct blood volume in the first tube, altering anticoagulant ratios. Which vein carries the highest risk of nerve puncture during venipuncture? A. Basilic vein. B. Cephalic vein. C. Median cubital vein. D. Accessory cephalic vein. Answer A. The basilic vein lies close to the brachial artery and median nerve, making it the riskiest choice. A phlebotomist must draw from a patient with a right arm dialysis shunt. The left arm has a small bruise. What should the phlebotomist do? A. Draw below the bruise on the left arm. B. Draw above the shunt site. C. Use the left arm, avoiding the bruised area. D. Draw from the shunt with sterile technique. Answer C. Never use an arm with a shunt. The non-shunt arm is preferred. Bruises are avoided to prevent hemolysis. Blood collected for glucose testing is placed in a gray top tube. What is the role of sodium fluoride in this tube? A. Preserves glucose by inhibiting glycolysis. B. Acts as an anticoagulant by binding calcium. C. Speeds clot formation. D. Prevents platelet aggregation. Answer A. Sodium fluoride stabilizes glucose by inhibiting enzymatic breakdown after collection. Which step ensures accurate blood-to-additive ratio in a light blue tube? A. Fill to the line mark on the tube. B. Invert the tube 10 times. C. Draw the tube last in the order. D. Use a larger gauge needle. Answer A. Coagulation tests require precise fill volume to maintain a 9:1 blood-to-additive ratio. Which additive prevents clotting by binding calcium ions? A. Heparin. B. EDTA. C. Sodium fluoride. D. Potassium oxalate. Answer B. EDTA chelates calcium, preventing the coagulation cascade and preserving cell morphology. Which of the following errors can cause hemoconcentration? A. Leaving the tourniquet on too long. B. Using a small gauge needle. C. Failing to invert tubes. D. Using alcohol that isn't dry. Answer A. Prolonged tourniquet application traps blood in the vein, concentrating analytes and altering test results. A phlebotomist accidentally collects a light blue tube after a serum tube. What is the potential error? A. The test result will remain unaffected. B. Serum residues may falsely elevate clotting factors. C. The order of draw prevents this issue. D. Additive carryover may neutralize the anticoagulant. Answer D. Coagulant residues from serum tubes can contaminate the citrate tube, altering coagulation test results. The correct order of draw begins with which type of tube? A. Blood culture. B. Serum. C. Coagulation. D. EDTA. Answer A. Blood culture tubes are drawn first to prevent additive contamination and maintain sterility. What occurs if the specimen for potassium testing is hemolyzed? A. Hemolysis has no effect. B. Potassium results are falsely decreased. C. Potassium results are falsely increased. D. The plasma volume decreases. Answer C. Potassium leaks from ruptured red cells during hemolysis, giving artificially high results. Which statement best describes the function of the anticoagulant in a green top tube? A. Heparin prevents clotting by inhibiting thrombin. B. EDTA binds calcium to stop clotting. C. Citrate reverses platelet activation. D. Fluoride preserves plasma glucose. Answer A. Heparin inhibits thrombin formation and is ideal for plasma chemistry studies. A phlebotomist must draw for a blood culture and a CBC. Which should be collected first? A. Serum. B. CBC. C. Blood culture. D. Any order is acceptable. Answer C. Blood culture tubes are always collected first to avoid contamination from additives or skin flora. A specimen for bilirubin must be protected from A. Light exposure. B. Air exposure. C. Heat exposure. D. Cold temperature. Answer A. Bilirubin degrades quickly when exposed to light. Wrap tubes in foil or use amber containers. Which test requires the use of a chain of custody protocol? A. Drug screening. B. Electrolyte testing. C. Coagulation testing. D. Blood typing. Answer A. Chain of custody ensures proper documentation and specimen integrity for legal or forensic tests. A patient's vein collapses during collection. The most appropriate next step is to A. Try another tube. B. Switch to a smaller gauge needle. C. Use a syringe or butterfly with less vacuum. D. Reposition the needle and retry. Answer C. Collapsed veins require a gentler suction method, such as a syringe or butterfly setup. Which step is critical after performing a capillary puncture? A. Wipe away the first drop of blood. B. Squeeze the site for better flow. C. Apply a tourniquet. D. Use alcohol to mix with the blood. Answer A. The first drop may contain tissue fluid. Wiping it ensures an uncontaminated sample. What is the most serious risk if a phlebotomist fails to activate the needle safety device? A. Specimen hemolysis. B. Additive contamination. C. Needle stick injury. D. Vein collapse. Answer C. Safety devices must be activated immediately to prevent accidental exposure to blood-borne pathogens. Which error occurs when tubes are not inverted properly after collection? A. Microclot formation. B. Hemoconcentration. C. Hemolysis. D. Excess anticoagulant activation. Answer A. Inadequate mixing prevents anticoagulant dispersion, allowing clots to form inside tubes. Which blood collection site should be avoided in a diabetic patient with poor circulation? A. Finger stick. B. Earlobe. C. Heel puncture. D. Venipuncture. Answer A. Finger stick testing in diabetics with poor circulation risks slow healing and infection. A specimen labeled with the wrong patient's name must be A. Corrected after verification. B. Discarded and recollected. C. Sent with a note to the lab. D. Labeled over the old sticker. Answer B. Misidentified specimens cannot be corrected. Recollection is mandatory to ensure patient safety. What should the phlebotomist do if a patient refuses a blood draw? A. Persuade the patient gently. B. Report the refusal to the nurse or physician. C. Proceed after explaining necessity. D. Wait until the patient changes their mind. Answer B. The patient has the right to refuse. The refusal must be documented and reported immediately. The safest site for heel puncture in an infant is A. Medial plantar surface. B. Posterior curvature. C. Lateral plantar surface. D. Arch of the foot. Answer C. The lateral or medial plantar surface avoids the calcaneus bone, reducing injury risk. A patient undergoing a lipid panel test arrives after eating a small meal. The phlebotomist proceeds with collection. Which consequence is most likely to occur? A. False elevation in triglyceride levels. B. False reduction in HDL levels only. C. Increased potassium due to digestion. D. No significant impact on test results. Answer A. Lipid testing requires fasting for 9 to 12 hours. Consuming food prior to the test raises triglyceride and cholesterol levels, leading to inaccurate results and possible misdiagnosis of hyperlipidemia. When collecting blood using a butterfly and evacuated tube system, backflow of blood into the patient's vein can occur if A. The tube is removed too slowly. B. The patient's arm is elevated above heart level. C. The tube is pushed back onto the needle after removal. D. The tube is held lower than the needle. Answer C. Reattaching a used tube can release residual vacuum and cause backflow of blood or additive contamination. This action is prohibited due to infection and contamination risk. A phlebotomist observes a patient's fluid running in the arm selected for venipuncture. What is the correct procedure? A. Collect from below the site to prevent dilution. B. Draw from above the site for better flow. C. Use the opposite arm or pause the for 2 minutes before drawing. D. Proceed immediately since fluids don't affect test results. Answer C. For fluids dilute blood, leading to erroneous results. The opposite arm should be used. If unavailable, the must be paused for at least 2 minutes and drawn below the site. During venipuncture, a patient suddenly experiences tingling and electric-like pain down the arm. The phlebotomist should A. Continue as long as blood is still flowing. B. Withdraw immediately and apply pressure. C. Reposition the needle slightly. D. Complete the draw quickly. Answer B. Tingling or shock-like pain indicates nerve contact or injury. Continuing can cause lasting nerve damage. The needle must be withdrawn and a new site used. Which of the following tests is most affected by a prolonged tourniquet application exceeding 1 minute? A. Sodium. B. Hematocrit. C. Total protein. D. Creatinine. Answer: C. Prolonged tourniquet time causes hemoconcentration, increasing analytes like protein, calcium, and potassium due to plasma water loss. A lavender tube filled to half capacity may cause A. Hemolysis due to vacuum loss. B. Clot formation due to insufficient EDTA. C. RBC shrinkage and falsely low hematocrit. D. Inaccurate glucose readings. Answer: C. EDTA is hypertonic. Underfilled tubes increase EDTA concentration, shrinking red cells and falsely lowering hematocrit or MCV values. Which action violates OSHA's bloodborne pathogen standard? A. Recapping a used needle with 2 hands. B. Wearing gloves during all blood draws. C. Using labeled biohazard containers. D. Disposing sharps immediately after use. Answer: A. OSHA strictly prohibits two-handed recapping due to high needle stick risk. Only one-handed scoop methods are acceptable if necessary. Which of the following tubes must be inverted exactly 8 to 10 times immediately after collection? A. Red top. B. Light blue top. C. Lavender top. D. Gray top. Answer: C. EDTA tubes require 8 to 10 inversions to fully mix the additive and prevent microclot formation, ensuring reliable hematology test results. When performing capillary collection, why should the first drop of blood be wiped away? A. It contains tissue fluid that may alter test results. B. It prevents rapid clotting of the sample. C. It ensures blood flows faster. D. It removes excess anticoagulant from skin. Answer: A. The first drop of capillary blood is contaminated with interstitial fluid, potentially diluting analytes and leading to inaccurate readings. A phlebotomist draws a CBC and BMP in the wrong order. What is the potential outcome? A. Cross-contamination causing clot formation. B. Hemolysis due to excess EDTA. C. Electrolyte imbalance readings. D. EDTA carryover lowering calcium results. Answer: D. Drawing EDTA before serum tubes can cause additive carryover, where EDTA binds calcium and falsely lowers calcium or magnesium levels. Which patient factor most commonly affects plasma potassium levels during venipuncture? A. Dehydration. B. Hemolysis during draw. C. Age of the patient. D. Fasting status. Answer: B. Hemolysis releases intracellular potassium from ruptured red blood cells, causing falsely elevated potassium readings. A phlebotomist labels a specimen tube after leaving the patient's room. This error primarily risks A. Laboratory contamination. B. Misidentification and result mix-up. C. Coagulation interference. D. Transport delay. Answer: B. All labels must be applied in the patient's presence. Labeling later can cause specimen-patient mismatches, violating identification policy and patient safety standards. If a patient faints during blood collection, the first step the phlebotomist must take is A. Withdraw the needle immediately. B. Elevate the legs first. C. Offer water or glucose. D. Call a physician before touching the patient. Answer: A. The first priority is to remove the needle to prevent injury, then ensure patient safety by lowering their head and elevating legs. During heel stick collection, the puncture should never exceed what depth? A. 1 mm. B. 1.5 mm. C. 2.0 millimeters. D. 2.5 millimeters. Answer B. The maximum depth for heel punctures is 1.5 millimeters to avoid contacting the calcaneus bone, which may cause osteomyelitis or injury. A phlebotomist suspects an arterial puncture due to bright red, pulsating blood. What should they do next? A. Apply light pressure and continue filling tube. B. Withdraw immediately and apply firm pressure for 5 minutes. C. Ignore and complete the draw. D. Label it as a venous sample. Answer B. Arterial punctures require firm pressure for at least 5 minutes to prevent hematoma formation and bleeding, and the supervisor must be notified. Which test is most sensitive to light exposure and must be wrapped in foil immediately after collection? A. Bilirubin. B. Glucose. C. Sodium. D. Bun. Answer A. Bilirubin breaks down rapidly when exposed to light, causing falsely low levels. Wrapping the tube in foil prevents photodegradation. Why is it critical to avoid excessive alcohol on the skin before venipuncture? A. It can cause patient burns. B. It may cause hemolysis and sample contamination. C. It prevents needle entry. D. It increases clotting time. Answer B. If alcohol isn't allowed to dry, it can enter the sample, hemolyze red cells, and interfere with certain chemical analyses. A phlebotomist performing a timed glucose tolerance test draws the 30-minute sample 10 minutes late. The result will likely be A. Higher than accurate glucose. B. Inconclusive but acceptable. C. Unchanged. D. Lower than accurate glucose. Answer D. Blood glucose decreases over time post-ingestion. A late draw gives falsely low readings, invalidating the test. Which of the following must be documented when performing venipuncture on a patient receiving anticoagulant therapy? A. Needle length used. B. Bleeding duration and control method. C. Tube color order. D. Blood flow rate. Answer B. Anticoagulated patients bleed longer. Documentation of pressure time and bleeding control ensures safety and compliance with care protocols. Which additive prevents glycolysis by inhibiting enzymes in glucose metabolism? A. Sodium citrate. B. Lithium heparin. C. Sodium fluoride. D. Potassium EDTA. Answer C. Sodium fluoride preserves glucose for up to 24 hours by blocking glycolytic enzymes, making it ideal for glucose and lactate testing. The phlebotomist notices a microclot in a lavender top tube. What should be done? A. Recollect the specimen immediately. B. Note it and send the sample anyway. C. Mix the tube harder to dissolve it. D. Spin it to separate plasma. Answer A. Microclots interfere with hematology results and cannot be corrected by mixing or centrifuging. Recollection is mandatory. Which specimen collection error leads to falsely elevated potassium and phosphorus results? A. Hemoconcentration. B. Underfilling citrate tubes. C. Shaking tubes vigorously. D. Delayed inversion. Answer C. Vigorous shaking lyses red blood cells, releasing intracellular potassium and phosphate, leading to erroneous elevations. In an emergency, a phlebotomist is instructed to perform a stat test on a trauma patient. What is the priority action before collection? A. Verify patient identity via wristband. B. Immediately draw from any available site. C. Collect first and label later to save time. D. Skip documentation for faster turnaround. Answer A. Even in emergencies, proper patient identification remains the first and most critical safety step to avoid life-threatening errors. Which specimen must be collected using a chain of custody protocol? A. Drug screening test. B. Coagulation profile. C. Cross-match blood test. D. Lipid panel. Answer A. Chain of custody ensures specimen integrity for legal testing such as drug screens, alcohol levels, or forensic analysis. Why must serum be separated from cells within 2 hours after collection? A. To prevent hemolysis. B. To avoid metabolic changes affecting test accuracy. C. To maintain tube vacuum. D. To reduce fibrin clot formation. Answer B. Cells continue metabolizing after collection, altering glucose, potassium, and enzyme levels. Prompt separation preserves true analyte concentrations.